Hello, and welcome back to another episode of Doc Mike, the Exercise Doc. Today, I'm going to be talking about low back pain. I'm going to limit my discussion to the two most common forms of low back pain, that due to back strain and arthritis. Now, to preface this, I need to say that anytime you have new onset back pain, or back pain that just won't go away or keeps getting worse, it's always important to check with your doctor to make sure there's not another medical condition going on. Most exams for back pain are fairly simple and straightforward and do not require x-rays or scans. The vast majority of back issues are mechanical in nature. What I mean by that is they're due to muscle issues, back strain, muscle spasm, muscle imbalance, or weak muscles. Even if you have arthritis or degenerative disc disease, a lot of the pain is due to mechanical problems. When people have arthritis, they do less. Their muscles start to atrophy, they develop poor posture and bad habits. Thus, most prescriptions for back pain include exercises. Now, not all exercises that I'm going to give you work specifically on the back. There are other issues that can lead to back problems. Tight hamstrings, or the muscles in the back of the legs, can alter the way we walk and the way we stand, leading to back issues. Tight hip muscles, in particular the hip flexors, which tighten up when people have desk jobs or sit a lot, can lead to back problems. The hip flexors attach in the front of the body to the hips and in the back of the body to the pelvis. So when they get very tight, they alter the anatomy and put strain on the back. In addition, if your core muscles, the abdominal muscles, the muscles in the back, are weak, the back doesn't have good support, and that can lead to back pain. I'm going to present a series of exercises that you should do daily to help improve and ideally prevent the recurrence of low back pain. Low back pain is a great example of an ounce of prevention equaling a pound of cure. Doing 10 minutes of exercises daily can help prevent missed work, can help you enjoy playing with your children or your grandchildren more, can help you with your activities of daily living, and can just help make you feel better moving throughout the day. For the first exercise, sit on a sturdy chair or bench. Cross one foot over the other knee, then hinge forward at the waist. Your back should not be bent, but should be in a neutral position. A stretch should be felt on the hip and the low back on the side where the leg is crossed. Hold the stretch for 30 seconds. As we discussed before in stretching, the stretch should not hurt. As you breathe, gradually go deeper into the stretch. Make sure you do both sides. The second stretch I like to call the couch stretch because it can be done with a couch or chair. Kneel on one leg with the top of your foot resting on the top of the chair. The other leg is in front of you. Now lean back. The stretch should be felt in your groin area. This is your hip flexor muscle, which can be affected when you sit a lot. Tightness of the hip flexors is a common cause for low back pain. Again, do both sides, and as you breathe, gradually deepen the stretch over 30 seconds. This is cat-cow pose. As the name suggests, you imitate a cat by bending your back as you exhale and arching your back as you inhale. Do this for 5 to 10 breaths. Next is child's pose. To do this, you lean back onto your heels while actively reaching forward with your arms. You should feel a stretch in your mid to upper back. Next, reach over to the right side as you lean back onto your heels. You should feel a stretch from your elbow to your ribs on your left side. Then alternate to the left side for a stretch on your right. Bird dog is next. As its name suggests, you raise the opposite arm and leg and hold it. This helps strengthen your core and your back by forcing you to balance your body. This is down dog, so named because of the way dogs stretch. Push back with your arms and raise your rear end up. Keep your hands and arms strong and try to keep your heels as close to the ground as possible. You should feel a stretch in your back, shoulders, hamstrings, and calves. Next, transition into up dog. Your hands and feet remain in the same location, but rest on the top of your feet. Push up with your arms and arch your back. Try to raise your hips off of the ground so the only thing touching the ground are your hands and feet. Continue with slow, deep breaths and hold for 30 seconds. Next, alternate between up and down dog in a slow, smooth motion. This is Superman. As the name suggests, you're in the position Superman is when he flies. Lie on your stomach, raise your chest and feet off the floor like you're flying. You'll feel this in your back muscles. Hold this position for 20 to 30 seconds. Next is plank, which strengthens your core to help support your back. Tighten your stomach muscles, your glutes, and your quadriceps. Your body should be straight like a plank. Aim to hold this position for 30 to 60 seconds. This is a side twist. Sit cross-legged and turn to one side. Use the arm opposite the side you're turning to pull on your leg to help deepen the stretch. Hold each side for 30 seconds. This is figure 4. Lie on your back, cross one leg over the other, and grab your shin. You should feel a stretch deep in your butt cheek. This exercise is excellent for people with sciatic pain. This is forward fold. Hinge at the waist and reach as far as you can. Grab the back of your legs for some leverage to help deepen the stretch. As you breathe, slowly increase the stretch. You should feel it in the back of your legs and also in your back. It's important not to bend your back, but to hinge at the waist. Lastly, bring your knees to your chest and give yourself a big hug. Remember, when it comes to low back pain, if you don't find the time, if you don't do the work, you won't get the results. So do something today that your future self will thank you for. That's all for today. I'll see you next time on Doc Mike, the Exercise Doc.